Vermont Governor Phil Scott, other state officials preparing to give their regular Tuesday update on the state's ongoing response to COVID-19. Let's go to Montpelier to listen in live to Governor Scott now.
Is going to be this afternoon at 2 o'clock instead of the usual 11 o'clock. So unfortunately, I don't have any new information to share with you just yet, but we'll let you know if there are any developments after that meeting this afternoon. Yesterday, we began phase 5A of our vaccine rollout. Those 55 and older with certain high-risk conditions. On the first day, under 10,000 have signed up, which is a bit fewer than we had hoped. As you may remember, we had planned to roll out 5B, those 16 and over, on Monday. So we're going to move that up. We're going to move that date up until up to Thursday instead. As a reminder, the total population of this group is about 75,000, so we want to make sure that we get to them as quickly as possible. Secretary Smith will talk about this in more detail in his remarks. At the same time, we also started on a parallel track to vaccinate school staff, child care providers, more troopers, and correctional staff. Again, this second track is possible as a result of increased federal supply, which includes the single-dose Johnson & Johnson vaccine. As we've done from the beginning, our focus has been about protecting the health and safety of Vermonters, and in this case, it's our kids. As the data has shown, they're struggling with mental health as a result of the pandemic and the remote and hybrid learning that came with it. That's why putting school staff and child care workers on this parallel track is critical and in line with our work to prioritize health and safety. Once we complete this phase, everyone in the state who is at most risk of severe illness and death will have had the opportunity to be protected. The good news is, so far, we've seen a high uptake rate, with over 80% of those in the 75-plus age band having received at least one dose. Getting the vaccine is important, not only to protect yourself, but the entire state. So the high acceptance rate is something we need to continue to strive for. So let's keep it up by signing up when it's your turn. Secretary Smith will have more on vaccines in a few minutes. Next, as you may have seen, yesterday the CDC made some changes to its guidance on gatherings for people who are vaccinated. I just want to remind folks that last week we made similar changes, allowing those vaccinated to gather with others who are vaccinated as well, and with one household that is not. On Friday, we'll be taking another step forward, this time for those who haven't yet been vaccinated, but we'll talk about that in more detail on Friday. Over the last 12 months, we've taken one of the most methodical and disciplined approaches to the virus in the nation, which has made us one of the safest states. After Halloween, we saw cases rise significantly because of large parties and get-togethers at homes. So before Thanksgiving, we restricted multi-household gatherings to help slow the virus down, and most importantly, to save lives while we were waiting for a vaccine. Since the January peak, and with vaccinations ramping up for the most vulnerable, we've seen a significant decline in deaths as well as hospitalizations. Our positivity rate has also come down from over 3% to around 1.7%, which is one of the lowest in the country. So on Friday, we plan to announce changes for small gatherings as well. This will have an impact on other areas like restaurants too, so stay tuned. I know everyone is anxious to get back to normal, but even as we vaccinate more people, it's as important as ever to follow the public health guidelines like wearing a mask, washing your hands, staying physically distant, and staying home when sick. We're in the final quarter of this very tough game, so let's all do our part so we can exit the pandemic as quickly as possible. And with that, I'll turn it over to Commissioner Pieciak for our weekly modeling update. Commissioner Pieciak.
Thank you very much, Governor, and good morning, everyone. This week in Vermont, we reported 901 new COVID-19 cases, over 200 more cases when compared to last week, and the most weekly cases we've reported in a month. You can see that the increase is represented in the increase in the 7-day average. A week ago, we were averaging under 100 cases. Today, we're averaging just over 130 cases per day. Certainly, the COVID-19 outbreak at the Newport Prison contributed to the rise in cases this week. However, even when you remove these cases from our case count, you can see that cases are still increasing in Vermont over the past few days, albeit more gradually. If we were looking solely at this case data, you might be discouraged. However, a closer look at our data reveals that we are making continued progress, and there are greater reasons for hope today than at any other time during the pandemic. First, looking at our most vulnerable age group, we see that even though overall cases have slowly improved and recently ticked up, the cases among our most vaccinated, those who are 70 years and older, have fallen more rapidly and continue to fall as well. Similarly, the number of long-term care facility cases has remained remarkably low, with only 5 cases in the last 3 weeks and only 2 active outbreaks. These critical improvements among our most vulnerable are not due to chance, but as the governor mentioned, because of the significant uptake in vaccinations that we're seeing among these populations. Over 82% of Vermonters 75 and older have either started or completed their vaccination. This compares to a U.S. average that's closer to 70% for this age group. We're also making significant progress among those 65 to 74 years old, with thousands more scheduled to receive their vaccines in the coming weeks. With fewer vulnerable individuals contracting the virus, we're also seeing reductions in hospitalizations. In particular, a steady decrease this week in the number of people in the ICU, and as of today, no one requiring ventilation. When you look collectively at these metrics and compare them to the peak we experienced back in January, you can see how much we've improved among these most vulnerable populations. And with these metrics improving, most importantly, we can anticipate the COVID fatality rates in Vermont will drop for the rest of this month and into the future, with March forecasting 7 to 10 deaths, a significant decrease from what we saw in December and a step down from what we saw in January and February. Looking collectively at this data, it is probably the most optimistic I have been since the start of the pandemic because we're seeing the impact of vaccinations. But to get to that finish line, we really need everyone to receive a vaccine and for all of us to continue to follow that basic public health guidance until we've made more significant vaccination progress. Even with the uptick in cases this week, Vermont is forecasted to have a steady trajectory of cases that will not rise any further, and is still projected to see a gradual decrease and then a more steady decrease as we get into spring. Similarly, our hospital forecast expects resources to be much more than sufficient to cover all the need over the next 6 weeks. And looking at Vermont's vaccination progress, for the first time, we are averaging over 4,000 daily doses administered on a 7-day average, which is a 14% increase week over week. In terms of where we rank nationally, in terms of doses administered, Vermont currently ranks 13th nationally and 3rd in the Northeast. And in terms of fully vaccinated Vermonters, we place 11th nationally. But another encouraging sign regarding vaccinations comes from a pulse survey conducted by the U.S. Census Bureau that found among those who are not yet vaccinated, almost 70% of Vermonters said they would definitely get the vaccine, which is the highest ranking in the country. But as you can also see, there's still a significant number of people who are unsure about the vaccine. And as you saw from today's data, getting vaccinated is the key to getting out of the pandemic, and it's certainly important to encourage your friends and your family to step up when it's their turn. Giving a brief overview of the regional and national data, you'll see that after a stall last week, the cases in the Northeast region have started to decrease again, with the region reporting 76,000 new cases this week, an 8% decrease compared to last week. And the other regional metrics are improving as well, with positivity rates, hospitalization rates, and fatality rates all continuing to decline. Further, the regional forecast continues to expect cases to decline over the next few weeks as well, all of which is good news for Vermont. Looking at the national numbers, we see continued improvement overall, with cases clearly back on the decline after a short stall 7 to 10 days ago. Cases are down 15% over the last 10 days, and national hospitalizations and deaths are also decreasing, with hospitalizations down 15% over the last 10 days and deaths down 14% over that same period. And finally, with the first confirmed case of the COVID variant B.1.1.7 identified in Vermont, we did want to show the rise in this reported variant across the country over the past few months from CDC data, just to let it serve as a good reminder that even with all of the positive information we're seeing in our case data, that the threat of the virus is certainly still real, and we need to do everything we can to protect ourselves and our communities by following the public health guidance and getting vaccinated when it's our turn. And at this time, I'll turn it over to Secretary Smith.
Thank you, Commissioner Pieciak. Good morning, everyone. As I mentioned last week, we started vaccinating new groups yesterday. They included public safety, the education community, those 55 and older with high-risk conditions. As a result of these efforts and others planned for next week, more than 110,000 people will be eligible to register for a vaccine. As of 9 a.m. this morning, among those 55 years old and older with high-risk conditions, as the governor mentioned, more than 9,000 people have made appointments. 8,600 teachers and school staff have also made appointments since yesterday. Next Monday, we are scheduled to open up 16 and above with the high-risk conditions, but given our supply of vaccine and ability to accommodate large numbers of appointments, we have decided to accelerate this time schedule to this Thursday. So beginning at 8:15 a.m. this Thursday, those 16 years old and above with high-risk conditions can make an appointment to be vaccinated by going to the state website, healthvermont.gov/myvaccine, or by calling the Vaccine Call Center at 855-722-7878. Again, at 8:15 on Thursday, those 16 and above with high-risk conditions can make an appointment to be vaccinated. Licensed child care providers will continue to be eligible to make appointments on Monday, March 15th, and those clinics available to teachers and school staff will be available to regulated licensed child care programs too. They will also be eligible to avail themselves of Walgreens appointments as well. Just a reminder, although teachers and school staff and child care providers have been given instructions on how to register, these groups can make an appointment through the state system with an educator's vaccination clinic when it has been scheduled. And they can make an appointment at Walgreens and bring their confirmation email to their appointment. The state website is healthvermont.gov/myvaccine, and Walgreens is walgreens.com. We are working to ensure there are vaccination sites in each district over the next few weeks. While they have instructions, some educators may not see sites near them in the system to make appointments at this time. We appreciate your patience as more sites are scheduled. As I said on Friday and previously, this will begin to ramp up pretty fast. Please choose a location near your home. So far, we have scheduled the following counties for next week: Addison, Bennington, Caledonia, Chittenden, Rutland, and Windham. Department of Corrections staff in Burlington, St. Johnsbury, Rutland, and Springfield locations have been offered vaccine and have completed their appointments. I really cannot express enough appreciation for the EMS teams that continue to support a successful vaccination program across our state. They've been wonderful partners in this effort to vaccinate each and every one in this state. They will start and complete the next round this week at St. Albans and Newport. Just to give an overall progress, as of today, 127,500 people have been vaccinated against COVID-19. 58,500 have received their first dose of vaccine. 68,900 have received their first and last dose. I just checked this morning, we're closing in on 200,000 doses of vaccine given to Vermonters. Areas with additional vaccine appointments. I just want to spend a few words about vaccine appointments. As you know, our goal is to make it easier for Vermonters to get vaccinated as soon as possible. For the next 6 days, we are adding additional vaccine appointments in the towns of Grand Isle, Colchester, Essex Junction, Derby, Island Pond, Randolph, and Hartford. If you would like to reschedule for an earlier appointment, please call the Vaccine Call Center at 855-722-7878. Once again, thank you for all that you do to help protect yourself, your loved ones, and your community. And now I'll turn it over to Dr. Levine for a health update.
Thank you. This morning I'm going to talk about a number of topics, including sports, the variant, the CDC, wastage, and vaccination of the BIPOC community. Today we're reporting 87 cases, 30 people in the hospital, including 7 in the ICU, with a 7-day average positivity rate of 1.7%. We're continuing to monitor spread in Franklin County and Stowe, where we were able to offer additional COVID testing opportunities last week and over this past weekend. We encourage people in those areas and across the state to take advantage of regular test sites, which you can find on our website, healthvermont.gov/testing. Remember, testing is still a critical tool to finding cases and stopping further spread. With all the excitement and anticipation of vaccination, it is so easy for the fundamentals like testing to be forgotten or to feel that they are no longer relevant. We also continue to see cases affecting workplaces, healthcare and childcare facilities, and schools. Sometimes cases in schools do affect sports teams, and we typically don't see spread to multiple other players. We have seen a situation involving hockey again recently, but we don't know if it's a result of play or other factors such as carpooling or gathering. Or perhaps if a player just acquired the virus because it was in the community or their own household and was infectious on the day of a practice or a game. Importantly, these types of situations do lead to students quarantining, which is definitely challenging, but they do not typically disrupt in-school learning. These instances just occurred in the past 10 days, and there were not significant problems before then in hockey since we allowed competition. Likewise, we have noticed isolated instances of basketball players with COVID, but remarkably little disruption to team activities. You heard yesterday that we officially now have discovered the B.1.1.7 variant in Vermont. We've expected this result for a while, as it's been discovered in virtually every state now, and mutations discovered in Burlington wastewater had already pointed to the likelihood it was here. So what does this mean? We don't need to change what we do to stop the spread of COVID, but this variant is easier to transmit, so we need to make sure we're fully committed to those prevention measures. You already know them, but remember, you can make them even stronger by doing things like making sure your mask is well-fitting or double masking. and definitely avoiding indoor crowded situations. The good news is that the data shows that current vaccines are effective against this variant strain, and Vermonters should have confidence in the vaccines available. So get vaccinated when you're eligible, and in the meantime, help protect your fellow Vermonters by wearing your mask, keeping your distance, and avoiding crowds. The other big news from yesterday was CDC's guidance for people who have been fully vaccinated. I was happy to see it really shows Vermont is once again ahead of the curve when it comes to deliberate easing of guidelines, while still maintaining important protections like mask protocols. This guidance includes: you can stay indoors with fully vaccinated people without wearing a mask or staying 6 feet apart if you are vaccinated. You can gather indoors with unvaccinated people from one other household, for example, visiting with relatives who all live together without masks, unless any of those people or anyone they live with is at an increased risk for severe illness for COVID-19. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested or quarantined unless you have symptoms, with some exceptions. But vaccinated people should still take steps to protect yourself and others in many situations, like wearing a mask, staying at least 6 feet apart, and avoiding crowds whenever you are in public, gathering with unvaccinated people from more than one other household, which in Vermont you should not be doing anyways, and visiting with an unvaccinated person who's at increased risk of severe illness or death from COVID, or who lives with a person who's at increased risk. Again, this all agrees with what we've laid out in our easing of gathering restrictions to allow Vermonters more freedom while keeping them safe. I should note, finally, that CDC did not make any changes to its travel guidance or recommending against medium or large-size gatherings, even of vaccinated people. There's another area of good news that I also want to highlight because there is a need to provide a little more context. As we've been putting thousands of doses of vaccine in people's arms and scheduling appointments for tens of thousands more, I've heard concerns about what is often called wastage. This is the amount of vaccine dosage that are not or could not be used. As of today, Vermont has had 458 non-viable or wasted doses, which accounts for 0.2%, a small fraction of all doses, well below the CDC's recommended standard of less than 5%. Our COVID-19 vaccine wastage rate to date is comparable to or lower than other routinely recommended vaccines. And that is with the number of challenges unique to the COVID-19 vaccines, including the time limits on use. There are always errors that result in a lost dose, including accidents, problems with equipment, as well as issues with planning. But I want to make it very clear, there's no person, program, or facility that wants a single dose to go unused. Everyone involved, from the depot team who received the federal shipments to the person giving you your shot, is committed to vaccinating every person who can be vaccinated. As more doses become available, we are committed to working together to improve and ensure the systems are in place to minimize wastage and keeping our rates as low or lower than they already are. And finally, I'd like to briefly outline some plans for another group we have prioritized for vaccination, Vermonters who are Black, Indigenous, and people of color. As we've said many times here, our data shows that BIPOC Vermonters are more likely to get COVID-19 compared to white, non-Hispanic Vermonters. They are overrepresented among COVID-19 cases in the state, making up 6% of the population, but 18% of positive cases. They have significantly higher hospitalization rates and rates of most chronic diseases, often related to issues of higher exposure to COVID due to types of employment or public transportation issues. They are also more likely, 54%, to be part of an outbreak than white non-Hispanic Vermonters, 22%. BIPOC Vermonters are more likely, 46%, to have had a household contact with a case than white non-Hispanic, 19%, and are more likely to be living in multi-generational households. We are working with community organizations to try to rebuild the trust in public health that has eroded through historical injustices, and to expand access to education and outreach. But we are seeing significant disparities in the rate of vaccination among BIPOC Vermonters compared to white non-Hispanic Vermonters. We have listened to our BIPOC community partners about the kinds of approaches that would work for them, and have learned that some element of prioritization is one pathway that may contribute to greater uptake of the vaccine. Yet our priority schemes to date, which emphasize older age and residents in a long-term care facility, do not always help this population due to the lower likelihood of living in such facilities or in having sufficient life expectancy. For example, compared to 20% of white Vermonters who've received at least one dose of vaccine, only 3.8% of Indigenous Vermonters, 9% of Black Vermonters, and 11% of multiracial Vermonters have received the vaccine. We can and must do better, not only in engagement, the building of trust, and reducing vaccine hesitancy, but in realizing better health outcomes. Our goal to achieve community immunity and to protect all Vermonters can only be achieved if we work to lessen the barriers and make vaccination equitably accessible to all groups of Vermonters. Over the past month, we've been holding vaccine clinics for eligible Vermonters and members of their household who are among the groups at higher risk for COVID-19 due to language barriers, such as English language learners. Beginning next week and over the ensuing weeks, we plan to continue and extend that strategy to other BIPOC communities where an eligible Vermonter who meets the age category, for example, may also bring other household members to be vaccinated. This will be statewide and not only in Chittenden County, from our southern border to mid-state farm workers to Indigenous Vermonters in the northern part of the state. Clinics will be arranged in coordination and with the support of community partners around the state. As we establish clinic locations, we will post information on our website at healthvermont.gov. I want to thank all of the individuals and our community partners and leaders who have provided us with the supports needed to meet this important aspect of our public health mission.